Kicked off with Dr. Rodrigo Cartin-Ceba, who is pulmonary and critical care here in Scottsdale. And I think you'll find the topics this morning quite illustrative and informative. And Rodrigo, welcome.
It's nice to be the first one. Everybody's awake and fresh. All right, so I want to talk about sepsis care, especially because over the last couple of years, there have been a lot of changes, not just a lot of new randomized controlled clinical trials, but also some changes in the nomenclature. So I thought it was important to give an update on sepsis. And I want to talk about personalizing the care of sepsis. I'm not going to tell you about a new drug that is going to target a specific molecular change, such as the drugs that now we're seeing in oncology or in rheumatology with very nice monoclonal antibodies that are specific for a disease. We don't have that for sepsis, unfortunately. This is a different type of personalization of therapy, a different type of individualized therapy for patients with sepsis. I have nothing to disclose for this talk, and I briefly wanted to talk to you about what are going to be the objectives of this presentation. First, we're going to talk about some general concepts of sepsis and the new definitions. Then we're going to talk about personalizing the guidelines. Then I'm going to give you some practical therapeutic interventions for the management of sepsis and septic shock. And we'll discuss a little bit about a few drugs that are on the pipeline for sepsis that hopefully will be available in the next few years. Why is sepsis important? Why do we talk too frequently about sepsis? Well, as you can see, there is up to 15 to 19 million cases of sepsis every single year. This is worldwide. Unfortunately, the vast majority of these cases are in developing countries where they have much less resources. Therefore, the mortality in those places is usually worse. 25% of the ICU admissions are due to sepsis. Just in the United States, every single year, more than 750,000 cases of sepsis that present to the ICUs. Unfortunately, the mortality continues to be significantly high, and obviously it depends on the severity of disease, but it goes anywhere between 20 to 60%. Cases that are more ill, patients that have shock usually tend to have a much higher mortality. And you can see that the deaths from sepsis per year exceed that from breast cancer, prostate cancer, and HIV combined. Therefore, the importance of sepsis. What is really disappointing is that